As politicians debate reopening the economy, medical professionals are racing to find a vaccine. The University of Arizona announcing just this week they've created an antibody test to identify those who may have immunity. ABC 15's Zach Crenshaw speaking exclusively with the dean of U of A's medical school. Zach?
For most of us, the coronavirus is something we heard about for the first time this year. But Dr. Michael Abecassis wrote his master's thesis on a coronavirus in 1980, and he's viewing this pandemic through a surgeon's eyes.
I went to the International Coronavirology Workshop in 1986.
Dr. Abecassis says it wasn't well attended because before SARS, coronavirus only affected animals.
This is a zoonotic virus. None of us have immunity to this virus. That's what makes it so dangerous.
And deadly. More than 140,000 people killed by COVID-19 worldwide. 150 right here in Arizona.
For immunocompromised patients, it's kind of a double whammy.
Do we know for certain if those who have already gotten COVID-19 have immunity now?
We don't. We know that you can get antibodies. The real question is, number one is how protective are these antibodies? And number two is, if they are protective, how long does that protection last? We really don't know that either.
The University of Arizona hoping to expedite that discovery, creating 250,000 antibody tests, which will be important to determining
how many of us have been infected. Who knows? I mean, it could be 10%, it could be 20%, it could be 50%, it could be 60%.
The higher that number, the better when it comes to reopening businesses.
If they have antibody, I think you're going to feel a lot better about having them go back into the workforce.
But even if there's immunity from reinfection, a lot of people will still be susceptible to contracting COVID-19 for the first time. So Dr. Abecassis says people should get used to seeing masks in public and social distancing for the distant future.
We're going to have to reopen this economy, and when we go back, it's not going to go back to the way it's always been.
Now, the U of A is still ironing out details on those antibody tests. They're working with the state and say soon people will be able to register for a future test, which will include a blood draw. Zach Crenshaw, ABC 15, Arizona.